Just 3 weeks ago, a massive recent study was quietly published in the Journal of the American Medical Association. And I am going to be honest with you, it basically proves that the one cardiovascular rule you have memorized your entire adult life is completely wrong. You have been told by every nurse, every television commercial, and probably your own primary care doctor that your ultimate goal is to force your blood pressure down to a perfect 120/80. You have been led to believe that this textbook reading is your golden ticket to health, and anything higher is a ticking time bomb. But this new data, which tracked over 15,000 older adults in real-world scenarios, reveals a deeply unsettling reality. For anyone over the age of 65, actively manipulating your aging body to hit 120/80 isn't just unnecessary. It is actively inducing catastrophic falls, silent kidney failure, and in devastatingly frequent cases, premature death. I actually have the exact top and bottom numbers that this new research proves will give you the longest, healthiest survival rate for your specific age bracket. I will reveal the exact answer later in this video, and you absolutely must stay with me to understand it. Because if I just give you the digits without showing you exactly what is physically failing inside your body to cause these devastating falls, you will walk into your doctor's office tomorrow completely unarmed. You will be entirely unable to defend yourself against the next prescription they try to hand you. So stick with me here. Before we go one step further into the biology, I need you to do something for me so we can see what is actually happening in the real world. Scroll down to the comments section right now and type your age, followed by your average morning blood pressure. Keep it simple, just like 72/140/85. I really need to see exactly what numbers you are running and how aggressively your doctors are treating you. Because the reality of what is happening in homes across the country is, well, it's frankly terrifying. I am Dr. Nova Ellis. Over my 10 years as a cardiovascular specialist, I have sat across from thousands of brilliant, aging adults who were swallowing handfuls of powerful pills just to satisfy an arbitrary number on a medical chart. I have seen the life-altering consequences of aggressively treating older, fragile bodies with the exact same rigid playbook we use for healthy 40-year-olds. It's a broken system built on outdated guidelines. My absolute priority is giving you the human, unvarnished medical truth so you can fiercely protect your own independence. I want to tell you a story about a woman named Eleanor, because what happened to her is the dark reality of this medical obsession. Eleanor was 78 years old. She was fiercely, stubbornly independent, living in her own home, doing everything herself. About 10 years prior, her primary care doctor had diagnosed her with mild high blood pressure, sitting around 152/88. He immediately put her on a daily pill. He firmly told her that they needed to get her down to 120/80 because that was where she would be safest from a stroke. It took some time, a few dose adjustments, and eventually a second medication. But eventually, Eleanor's home monitor started flashing that perfect celebrated number. She was hitting 122/78. Her doctor was absolutely thrilled. He praised her for being such a good, compliant patient. But Eleanor started noticing something strange. Whenever she stood up from her favorite armchair, the room would suddenly tilt. A heavy wave of dizziness would wash over her, forcing her to grip the furniture tightly until her vision cleared and the room stopped spinning. When she bravely mentioned these frightening episodes to her doctor's office, the doctor gently brushed it off. Just an age-related thing, they said, claiming her blood vessels just weren't as elastic anymore, and she just needed to make sure she stood up a bit slower. They looked at the perfect numbers on the glowing computer screen and completely ignored the living, frightened woman sending them desperate warning signals. Then, one morning, Eleanor woke up to use the restroom. She sat on the edge of the mattress, pushed herself up, and the room violently spun out of control. Her vision tunneled into darkness. Her knees simply buckled beneath her weight. She crashed hard onto the hardwood floor, her right hip taking the full, brutal, unforgiving impact against the nightstand. The pain was blinding. When the paramedics finally arrived and checked her vital signs as she lay flat on the floor in agony, they discovered a horrifying truth. While lying down, her blood pressure was a seemingly fine 118/74. But the moment they gently propped her up to a standing position, her pressure plummeted to a terrifying 82/54. Her heavily medicated body was entirely incapable of pumping enough blood upward to her brain against the natural force of gravity. The perfect 120/80 on her medical chart had literally starved her brain of oxygen the exact second she stood up. Eleanor had suffered a catastrophic complete hip fracture. And, she survived the highly invasive replacement surgery, but she never really recovered. She was transferred to a sterile rehabilitation facility, where the sheer terror of falling again kept her mostly immobilized in a bed. Because she wasn't moving, fluid slowly pooled deep in her lungs, turning into severe, treatment-resistant pneumonia. Her exhausted body simply could not fight off the infection. 3 days after being admitted back to the hospital, Eleanor passed away. And then everything changed. She didn't die from a failing heart, she died from a perfect number. This tragedy forces us to ask a really logical question. Why does a blood pressure reading that is wildly celebrated in a 40-year-old become an absolute death sentence for an 80-year-old? To understand this, I need to explain what is happening inside your blood vessels in plain, everyday language. When you are young, your arteries are like fresh, bouncy rubber bands. They stretch out effortlessly to absorb the forceful wave of blood pumped by your heart, and then they snap back smoothly. But as the decades pass, they undergo a structural change. They get stiff. The elastic tissue wears out and is replaced by rigid materials, meaning your arteries basically turn into stiff, hardened pipes. Because these pipes are so incredibly stiff, your beautiful, exhausted heart intentionally generates a slightly higher pressure just to force the thick blood through them. Your body is creating that higher pressure on purpose. It needs that extra force to ensure the blood travels upward, against gravity, to properly nourish your brain. On top of this stiffening, your body relies on tiny pressure sensors in your body, located primarily in your neck. In a young person, the exact moment they stand up, gravity pulls their blood down toward their legs. These tiny pressure sensors instantly detect the drop in pressure and scream at the brain, which immediately tells the heart to beat faster and the vessels to squeeze tight. This instant reflex is what keeps you from passing out. But as we get older, those delicate internal sensors get sluggish. They react much slower. If you forcefully medicate a senior with heavy pills to maintain an artificially low baseline pressure of 120, and their internal sensors are too sluggish to react when they stand, the pressure just bottoms out completely. The brain gets zero oxygen. The room spins, the knees give out entirely, and a hip shatters on the floor. I want you to go to the comments again right now. If you or your spouse ever feel dizzy, lightheaded, or suddenly unsteady when you stand up from a dining chair or get out of bed in the morning, simply type the word dizzy. Do not ignore this feeling. I need you to see how many other seniors are dealing with this exact same hidden side effect. It is one of the most critical, immediate warning signs your body can possibly give you. Let's talk about individual situations, because this is never a one-size-fits-all thing. It's just not. Take Harold, for instance. He was a very active 72-year-old man who played golf twice a week, and he had absolutely no diabetes or heart disease. His blood pressure naturally sat around 146/88. Another younger doctor panicked at the sight of that number and heavily medicated him down to the 120s. Harold sat in my exam room, looked down at his hands, and admitted he felt completely miserable. He was perpetually exhausted, dizzy, and his mind felt hopelessly foggy. His entire quality of life had been stolen by a pill. We safely tapered his medications over a few weeks, allowing his pressure to comfortably rise back to 136/82. His energy surged back immediately. That slightly higher pressure was exactly what his aging brain required to function optimally without falling. But then we must look at Margaret, who was also 72 years old. Unlike Harold, Margaret had a history of advanced diabetes, existing kidney damage, and a previous mild heart attack. For Margaret, letting her blood pressure casually sit in the mid-140s was genuinely dangerous. Her fragile, damaged kidneys and compromised heart simply could not withstand that constant, elevated pounding. For her, we had to carefully target the 130s, monitoring her constantly for any signs of dizziness. And finally, consider Ruth. Ruth was 83 years old, quite frail, and dealing with multiple medical problems including heart failure and chronic kidney disease. Her blood pressure routinely measured 168/92. Her previous doctor wanted to aggressively lower it, but I absolutely refused to let him push those numbers down. For an 83-year-old with existing balance and mobility issues, a low-pressure fainting spell is an absolute death sentence. We safely left her pressure slightly higher, hovering around 160/90. She felt perfectly fine, she remained stable, and she lived out her remaining years independently without ever suffering a catastrophic fall. We also have to talk about the massive gap between the older guidelines you have heard about and what recent science proves. For a long time, doctors followed the SPRINT trial, which recommended pushing blood pressure as low as possible. But here is the catch that most people missed. The SPRINT trial actually excluded a huge portion of typical older adults. They excluded people with diabetes, people with prior strokes, and people who were severely frail. So they built an entire medical protocol based on people who do not represent the average 80-year-old. Then came the massive JAMA study published recently, which followed 15,000 real-world older adults over the age of 75. They included the frail patients. They included the diabetics. And they found that the group with a systolic pressure below 120 had a much higher risk of falling, fainting, acute kidney injury, and death. The absolute sweet spot, the pressure range associated with the longest survival and the highest daily quality of life for these seniors, was not 120. It was higher. This brings us to the exact numbers this recent study has finally revealed. These are the specific sweet spots associated with the absolute longest survival and the highest daily quality of life for older adults. I want you to listen very carefully to the category that fits you right now. If you are between the ages of 65 and 75, and you are generally healthy, active, and free of major cardiovascular diseases or severe diabetes, the safest target for your top systolic number is between 130 and 140. Pushing your pressure significantly below 120 provides minimal extra protection for your heart, but it massively increases your risk of fainting, acute kidney injury, and dangerous falls. If you are between the ages of 75 and 85, your arteries are naturally stiffer, and your internal sensors are notably slower. For your age group, the ideal top target shifts slightly higher. It safely sits between 135 and 145. This range ensures that your aging brain receives adequate, oxygen-rich blood flow while still minimizing the long-term risk of severe vascular damage. If you are over the age of 85, or if you are dealing with significant frailty or use a mobility aid regardless of your specific age, preventing a fall is the absolute highest priority of your entire medical care plan. For this group, we safely target and accept a top systolic number between 140 and 150. The theoretical risk of a stroke from this slightly elevated pressure is vastly outweighed by the immediate, life-threatening danger of a low-pressure fainting spell on the bathroom floor. I also have to quickly mention the bottom diastolic pressure. You really cannot ignore it. That bottom number measures the resting phase between your heartbeats. Your actual heart muscle fills with its own blood supply primarily during this brief resting phase. If heavy medications force that bottom number significantly below 60, you are physically starving your own heart muscle of vital oxygen. The ideal bottom range for older adults generally needs to remain safely between 70 and 85. Don't suffocate your heart just to please a textbook. Take a second and leave another structured comment for me right now. Has your doctor ever discussed these higher, age-appropriate targets with you? Or are they still pushing you to reach 120? Just type, "Yes, we discussed it," or "No, still pushing 120. Your comments expose exactly what is really happening in the mainstream medical system today. So, what do you actually do with this information? First, do not throw your prescribed blood pressure pills in the trash. Please. Stopping powerful cardiovascular drugs cold turkey can trigger a violent, life-threatening rebound pressure spike. It's incredibly dangerous. Instead, you need to scientifically test yourself for the exact silent condition that killed Eleanor. It is called orthostatic hypotension, and you can test for it safely in your own bedroom today. Get your digital home blood pressure monitor. Lie completely flat on your back on your bed for 5 full minutes, allowing your cardiovascular system to completely relax. Take your blood pressure while lying down and write those exact top and bottom numbers clearly on a piece of paper. Then, stand up safely. Don't rush, but stand up. The very second you are fully upright, take your blood pressure a second time. Look closely at the top number. If your top systolic number dropped by 20 points or more the moment you stood up, you are in immediate, undeniable danger of a fall. You are actively experiencing orthostatic hypotension. Your brain is losing blood. You must maintain a strict written log of these lying and standing numbers for 2 entire weeks. Take that physical piece of paper directly into your next doctor's appointment. Do not just vaguely complain about feeling a little tired. Look your physician in the eye, hand them the hard data, and demand a calm, rational conversation about gently reducing your medication dosages. Tell them you want to prioritize your daily physical function, your mental clarity, and your safety over a rigid, outdated guideline designed for middle-aged adults. A good physician will look at that data, listen to your symptoms, and gladly work with you to slowly taper your medications until you find the perfect, individualized balance. If your doctor refuses to look at your data and completely ignores your dizziness just to force your numbers down to 120, you might be dealing with a dangerous provider. In geriatric medicine, there is a golden rule. Treat the patient, not the number. It means looking beyond the sterile lab values to consider what is actually best for the living, breathing human being sitting on the exam table. The days of blindly forcing every single aging adult into the exact same textbook cardiovascular box are over. Lower is absolutely not always better. Sometimes, as Eleanor tragically proved, lower is the exact thing that destroys the beautiful, independent life you have worked so incredibly hard to build. If this new research made sense to you today, subscribe to this channel right now. My ultimate goal is to arm you with the unvarnished medical knowledge you need to sit confidently across from any doctor and advocate fiercely for your own survival. Take the link to this video and share it directly with a friend or spouse who is currently swallowing handfuls of pills trying to reach an arbitrary number that might be quietly doing them harm. Trust your body. Protect your heart. I'll see you next time.